moving at all. So that particular thing, during this particular normal track, how this testis is coming, this is remaining here. So out here, this is what we are talking here is Gubernaculum testis is kind of important, which is a fibrous or fibromuscular embryological band that is a guide wire for this particular travel thing for the testis and the ovary. Now this particular Gubernaculum testis and Gubernaculum ovary both are kind of present in both subjects. And the fate is different in case of the male and in case of the female. In case of this testis, the gubernaculum remains there uninterrupted. It forms this particular shrinkage completely and guides this testis to move out of this abdominal cavity to this scrotal side. In case of the female subject, the gubernaculum ovary is interrupted by the growth of the uterus. Now, in case of this particular gubernaculum ovary, we have the modification that you have to keep in mind because those things are tested or asked in examination. So, in case of the gubernaculum ovary, which is also the same thing, remaining at the lower pole of the ovary has a different fate. What different fate is there? Because in case of the female subject, we have the development of uterus. So, this uterus comes in between the descent of or descending pole of the ovary which is growing in here. So, it is ovary if it is there and if it is the G or gubernaculum which shrinks and pulls this particular ovary down. Now, just like testis, it should be going out of this abdominal cavity as this gubernaculum is shrinking. In case of the female subject, as this particular uterus with the fallopian tube grows in, this particular gubernaculum tract or this fibers is interrupted. And as a result of that, the ovary do not come out of this particular abdominal pelvic cavity, it remains there. Now, what happens with the gubernaculum? It forms a ligament string like this. So, this in phase of this female subject, the gubernaculum forms two ligament structure. One structure we call them as ovarian ligament. So, this ovarian ligament is going from this ovarian pole to this particular side of the uterus. And rest part of the gubernaculum, it forms a ligament. We call them as round ligament. So, this round ligament as it goes down at the fag end, it breaks down into small fibrous strands and anchors to the skin around these female external genitalia. So, this fate of the gubernaculum in case of the female subject that you have to keep in mind that is being tested in examination. Whenever you come to the specimen with this female composite viscera, we come with this particular ovarian ligament. We come to this particular ligament, we call them as round ligament. And in examination, we ask this question and with zero result on this and yielding in a 100% failure rate in examination and 40% re-failure rate just like your senior batch had. So, they also behave like you guys what you are doing right now and repeating the same thing. So, it is up to you, your choice, what you are bracing for. But anyways, the fate of the gubernaculum in case of the female is different. Why different? I already have explained it. In case of the male subject, female subject and male subject have a different fate because in a male subject, we do not have uterus developing in and this gubernaculum shrinks properly and completes this particular descent of this particular testis from the abdominal cavity to the scrotum. Now, other thing about this particular descent of this testis. When this testis is going down from this particular pelvic cavity to the scrotum, it is covered and wrapped by a fold of peritoneum. That fold of peritoneum, we call them as processus vaginalis. That fold of the peritoneum goes along this particular testis as it is going down. So, this processus vaginalis becomes tunica vaginalis in case of this particular testis. Now, this processus vaginalis have got two layers. It has got a visceral layer and has a parietal layer. So, that means this processus vaginalis, which is a fold of peritoneum, wraps around this particular testis as it is going down. What this particular processus vaginalis is there is nothing but the peritoneum, which this particular structure present around the abdominal cavity. So, a piece of peritoneum moves along with this particular testis that is going down. We call them as processus vaginalis. So, this processus vaginalis wraps around the testis and make double layer thick. So, this particular processus vaginalis, if it holds some fluid inside by accident or by some kind of like error, we have a testicle surrounded by a fluid. We call them as hydrocele. So, that particular hydrocele is born with the kid when the kid is born. So, we call this as congenital hydrocele. So, this is congenital hydrocele is nothing but the processus vaginalis filled up with fluid, which this kid is born with the testicles completes its descent, but inside this particular testicles, which the scrotal sac is residing on, we have a fluid covering to it. We call them as congenital hydrocele. Similar to that, as this particular processus vaginalis, this peritoneum fold contains something else. What it may contain? It may contain some coils of intestine. So, coil of intestine, small intestine may also go along with the processus vaginalis. Then we call them as hernia. We call this as inguinal hernia. Now, this inguinal hernia is the kid is born with. We call them as congenital inguinal hernia. So, this is what the clinically we see this along with the descent of these testicles, which is happening because of this gubernaculum pool along with this processus vaginalis which is coming in. That is what you have to keep in mind related to this particular two clinical condition. One is congenital inguinal hernia and congenital hydroceles. And you understand why this particular thing matters, because kids are born with these diseases are kind of like a concern for the patients, concern for the parents, and they will show up with the problems with this, and you have to explain it why this particular thing is happening, something error, or else they will blame you during the child delivery. You have delivered something misnomer or something wrong you have done. That is why the kid is having this kind of problem and sue you in a court of law. So, anyways, so these are the two things related to the gubernaculum of the testicles and the gubernaculum ovary, the fate of that in male and female, that you have to keep in mind related to these particular problems. Other than this, the anomalies of the testicles, we call them as cryptorchidism and undescended testis, which we have learned about this, and ectopic testis, that means it's a deviation of the testis other than this particular normal testicular root or end root. It may be migrating out somewhere else, running away somewhere else, going to the elsewhere like under the penis, perineum, thigh, etc., femoral canal, skin, anywhere. So, that particular abnormal positions of this testicle, we call them as ectopic positions. And cryptorchidism or undescended testis, that means it is delayed or held up in the normal tract. So, these two differences that you have to keep in mind. The testicles which have the gubernaculum in a male which has a small strand like this holding the lower pole of the testicles. In case of the female, we have the round ligament, we have the ovarian ligament which is placing in. And why this is differently formed? Because of the development of the uterus which is going on. So, this is what we have to learn, we have to understand. This is what we are talking about, processus vaginalis. Along with that, we may have this blood vessel going on, we may have a fluid trapped inside, we have a kind of coils of intestine. Based on that, we may have this particular clinical condition. Congenital inguinal hernia, congenital hydrocele or congenital encysted hydrocele. That means part of this have a kind of cystic swelling, rest thing is fine. So, this is a kind of middle part which have got hydrocele cavity which is present in it. So, these are the different varieties of the testicle errors, and the ovary development is more or less the same, where from the germ cells are coming, where from this particular rest of the cells are coming, and gubernaculum of ovary which is important, and the fate of the gubernaculum ovary is important. What it forms in case of this particular gubernaculum ovary, ligament of ovary and ligament of the round ligament of the uterus, which is different in case of the male and female subject. And again, it may have the error, like it may have absent one side ovary, may have a duplicated to the other side, may have a present in their descent mode, it may be present in elsewhere. In case of this, may have move to somewhere else, or ectopic positions of the ovary may be there as well, just like the thing which I have started. So, this covers this development of the ovary. Now, we have to learn a short brief course of this particular female subject development of the uterus, fallopian tube and the vagina, a little bit of it, because it's not very important just like the ovary development, but we just like have a knowledge on how these things are going on, because the developmental error of the uterus is having some kind of significance. We may see some abnormal positions of abnormal shapes of the uterus. For that reason, we have to know where from this particular uterus is developed, and the parts of the uterus. That means we have this particular uterus having fundus, body, fallopian tube, and the vagina where from it is coming, and relevance to it. This is a very small part of it, so and rather easy. Now, all the organs in case of this particular female subjects, the gonads or this particular, other than gonads, like the female reproductive subjects or this vas deferens elsewhere, all the tube system develops from two tubes together. We have two tubes developed in our body, in our system. One of them we call them as mesonephric kidney system, which is going to form the duct system. We call them as mesonephric ductules or mesonephric duct. Besides this mesonephric duct, there is another set of duct develops. We call them as paramesonephric duct. So, there are two pairs of the duct we are born with, we develop in. So, one pair transforms into one, other pair disappears completely in subjects. So, in case of the female subject or in a male subject, so you have four duct system, right and left together, joining together, two mesonephric duct right and left, two paramesonephric duct right and left. This is a very beginning phase where we have this particular two pairs of the duct system in the primitive system. Now, what happens? This mesonephric duct remains in the male subject, and rest of this mesonephric duct in a female subject completely disappears. There are no role whatsoever the mesonephric duct in a female subject. They becomes rudimentary, they become something else. The reverse thing happens in case of the female subjects. So, in a female subject, the paramesonephric duct remains and mesonephric duct completely replaced with something else. So, in a nutshell, that in a male subject, we have the mesonephric duct that forms this particular male organs which is relevant, and in a female subject, the paramesonephric duct that forms the duct system or the female organs that is relevant, and rest thing is completely regress or repressible. So, if I represent with this particular pictures, that will help us to identify what do we try to mean to say. So, we have these two duct system like this picture you are seeing here. One is this green one, other is the red one. The red one by the side of the mesonephric duct, we call them as para. So, right and left paramesonephric duct system, and this one which you see here in the green, we call them as mesonephric duct. This mesonephric duct is given from the mesonephric kidney or mesonephric kidneys, which they are not using. So, this mesonephric duct, they are used by this particular male gonad system. So, this green one is present eventually in the male subject. The red one in the male subject is completely destroyed, damaged, or kind of replaced. The reverse thing happens in case of the female subject. The green one, the female one do not use that. That becomes non-useful, regressed and becomes something else. What the female do? They use this particular red duct system to develop the female organs. That's what we are coming here or gathered here to understand here. So, first we talked about this particular blue one that we are familiar with. The mesonephric duct in case of the males, which is present in the male, and female they do not have any trace of it. So, what this mesonephric duct in male does? It forms these efferent ductules from this, which forms this particular epididymis. From the epididymis it forms a vas deferens. From the vas deferens it forms this ejaculatory duct, and the gland out here we call them as seminal vesicle. So, this duct system that you are seeing here, this one, the green one, that is going to form the tubules, that means the efferent ductules, then this particular thing is forming the epididymis, then it forms this particular vas deferens. This is what this particular mesonephric duct is forming. All the pink and the purple, the mesonephric duct that yields in a male subject. Joining this particular seminiferous tubules are rete testis and forms this particular exit route for the sperms. So, this is how this particular mesonephric duct in a male subject that contributes. So, they are contributing to form this particular epididymis to this particular ejaculatory duct intervened by this seminal vesicle which is formed. In case of the female subject, this thing is not there. What they form? They form some embryological remnant present in the broad ligament, insignificant. We call them as epifuron, parafurons. They are kind of remnant tissue, they have no use. So, this duct which is forming this epididymis, ejaculatory duct, the efferent ductules in the male subject, they becomes these rudimentary tissues in case of the female subjects. Epifuron, parafuron, where they are found as a content of the broad ligament. Yesterday we were talking about the broad ligament content, front to back, along with the blood vessels, nerves, etc., etc. Along with that, we have these embryological remnants, we call them as epifuron, parafurons. They have no use of it. So, these things, what is fate of mesonephric duct? In case of the male, it forms some significant role. In case of female, no role. This is MCQ that you have to keep in mind. What forms this mesonephric duct in adult male? What forms the mesonephric duct in adult female? In female, nothing significant. Some content of the broad ligament. In case of the male, it forms these efferent ductules, and then we form this particular thing, we call them as epididymis or canal of epididymis, vas deferens, ejaculatory duct and seminal vesicle. That is it. Now, coming to the other story of other systems, paramesonephric duct, that means this red one. Now, what happens to the red one in a male subject? They have no role. So, they do not use that. This particular thing which is in the male subject, they form some vestigial organ around on the top of testicles. They do not use that anymore. So, in case of the red guy or red tube which is known as paramesonephric duct in male, nothing forms significant. In case of the female subject, they have these things which is going to form. Now, see that right side paranephric duct, paramesonephric duct and the left side paramesonephric duct. See that in the midline they come close and the lower part or caudal part they unite. So, they unite at the bottom end, upper end remains open. So, this upper end remains unfused, which is having a opening here which is opening in the abdomen or pelvic cavity. So, this unfused part of this paramesonephric duct over here forms the fallopian duct system. So, this fallopian duct right side, left side eventually is formed by unfused cranial part of paramesonephric duct. This is what they are coming into it. What they are doing? The lower caudal part or lower part of this paramesonephric duct, they unite. They form a common unit. We call them as uterovaginal canal. So, this uterovaginal canal, they have upper part and they have lower part. So, this upper part of the uterovaginal canal, they form this upper part of this particular fundus, body and part of the cervix of the uterus. What happens to the lower part of the uterovaginal canal? They form a dilated part, we call them as sinovaginal bulb. The sinovaginal bulb later on becomes flattened. They becomes a plate, we call them as vaginal plate. On the vaginal plate, there appears some kind of canal or opening afterwards. So, it becomes lumen established over here. So, this particular vaginal plate becomes canalized and forms this particular vagina. So, this particular thing is formed from this part. So, this is what we have to know, what contributes to this particular paramesonephric duct in a female subjects. So, again starting with this particular tubes, two tubes in the female subjects form these two tubes. We have to develop or we develop this particular thing, we call them as the fallopian tube right and left. We have developed this fundus, body, cervix and the vaginal tract, form these particular two tubes uniting. Upper part remains ununited. They forms this particular fallopian tube like in the female subject right and left. Lower part unites and forms this common tract, we call them as uterovaginal canal. This upper part of the uterovaginal canal becomes elongated and this uterovaginal canal upper part forms this particular fundus part, body part of the uterus and the cervix part. Caudal part which is going down, which forms the lower part of the cervix and forms a bulb over here. So, this bulb we call them as sinovaginal bulb and beyond this particular sinovaginal bulb there is a formation of the plate which is known as the vaginal cord, which becomes vaginal plate eventually. That vaginal plate becomes canalized to form this particular vagina. So, this particular whole tract which is coming on here, paramesonephric duct, is yielding the thing. Where they are starting to form around 6 weeks of life. So, they are forming these particular parts that we are starting over here. So, from this particular upper part we have this fallopian tube, lower part we have this particular part of this uterus body and the cervix. Even further lower part we have this particular vaginal cord and vaginal plate which becomes canalized to form this particular entire vagina, and this particular vagina which is opening into canal of the cervix to the cavity of the body of this particular uterus which becomes canalized, and this particular element which is open in here. So, this is how the whole thing is forming. So, now the story of whole thing forming does not play any role because they do not ask the descriptive part of how these things are formed. Rather, they ask the difficulties or problem in the formation. What problem in the formation can occur? If this particular union of right and left paramesonephric duct is faultily formed, we have anomaly in the formation of uterus. That is what you have to know. So, development of the uterus, that we have seen that uterus develops from following sources. From the uterovaginal canal, the lower caudal part of this particular fused part of this paramesonephric duct, and then the surrounding muscle tissue which is coming from myometrium, fallopian tube remains unfused part from the paramesonephric duct. This is what we have learned. So, anomalies of the uterus, if you have right side paramesonephric duct, left side paramesonephric duct not meeting properly, that can create a number of the uterine problem. We call them as bicornuate uterus, where this paramesonephric duct and right and left unites at the lower further part and makes a dent in here like this. So, we have this particular uterus have split here in the part of it in the midline. We call them as bicornuate uterus. Sometimes we have this particular one side paramesonephric duct develops, other side paramesonephric duct do not develop. That can lead to unicornuate uterus. That means one half of the uterus is formed, other half is never formed. Another form, this particular paramesonephric duct, right side and left side meeting in the midline and forming this particular common tract, we call them as uterovaginal canal. Now, this particular uterovaginal canal remains with a partition that we call them as septate uterus. This is very common with the septate uterus. May have the uterus split into right half and left half. The cervix may have a right part and the left part, or may have a continuous part. But beyond the cervix, this cavity of the uterus may have a partition there, right side partition, left side partition, where this particular faulty union of this lower caudal part of the paramesonephric duct has formed. Other thing can happen, uterus with have the two of them, right side and left side. We have a two uterus where this particular right side and left side paramesonephric duct at the bottom never united. So, we have the right side half uterus, left side half uterus, which is communicating with this opposite with here right side cervix and left side cervix, where the lips of the cervix are the uniting, but the cavity of the cervix remains separate. So, we have this cavity of this uterus separate, we have cavity of the cervix separate, and they are opening in the common opening of the vagina. So, these things can happen. We call them as bifid uterus, also known as uterus dishealth, which is having this two uterus having this errors. So, this error may be given in examination asking you what developmental error might have go wrong or went wrong to this particular error in this development. So, congenital abnormalities of the uterus that you have to little bit about concerned with. Now, this is what we are talking about, the paramesonephric duct in a male subject. In case of the male subject, as I have said, they do not use anything. So, normally this particular male subject, the paramesonephric duct shrinks because of the anti-Mullerian antigens or anti-substance. They regress this particular paramesonephric duct substance and they degenerate completely and form some twigs. We call them as appendix of testicles. They kind of like a bump or prostatic utricles which is present in the substance of the prostate, they remains within it. So, in case of this particular paramesonephric duct and this particular mesonephric duct, the fate of it, that what you have to keep in mind related to the developmental fate of this two duct system, in case of the male, in case of the female. So, this basic thing you have to know about the genital duct system, where this particular male subject is using the mesonephric M for M, The paramesonephric duct is used by this particular female subject. Paramesonephric duct is forming the fallopian tube, uterus and this particular cervix and vagina. They are forming from this particular tube. Male do not use this. What the male use is the unused part of this particular kidney system. We call them as mesonephric duct or coming from the mesonephric kidneys. They use this same duct system used by the unused kidney or replaced kidney. So, they use this particular duct system to replace that, form this efferent ductules, epididymis and the ejaculate duct system in the male subjects. So, this is what that you have to keep in mind related to this particular transformations of this particular duct system in the male subject and the female subjects, and development of the uterus, which part is developing from it, and errors of this particular uterus like double uterus, absent of the uterus may be there, because if their uterus is not formed, separate uterus, that means we have a septations between them, unicornuate, bicornuate, etc. That is what you have to keep in mind related to this particular developmental error or developmental issues with this particular thing related to it. Now, coming to this particular development of the vagina, as I have said, which is coming from the sinovaginal bulb, which is having this particular thing coming from two sources. So, this vagina developing here, which you are seeing here, is partly coming from above hymen, which is coming from the same source. We call them a sinovaginal bulb, which is united lower part of it, which is elongated forming this, and lower part, which is below the hymen opening of this vagina, is developed from the urogenital sinus, also known as endodermal part. So, that is why this particular exterior of this particular or external vaginal opening has a different nerve supply, different lymphatic drainage, compared to this particular upper third or upper part of this particular vagina has a different nerve supply, different lymphatic drainage and the blood supply accordingly. So, this is what you have to know, you have to carry about this particular today's class related to the fate of this paramesonephric and mesonephric duct system and this particular abnormalities of this uterus, how this particular uterus is abnormally formed and what could be going wrong with this particular uterus error. So, this is all for the day. Next day we are left with a small class about external genital development and quick recap of the thing that you have learned in case of this abdominal and urogenital system like developmental segment. We have this exam questions which is coming for these your second term exams, which includes this development of this part like GI system development that is included in it. The renal system development is also included in this particular questions will be there, and this particular reproductive system development and developmental error will be included in the exam section for your second term exams, which is going to due in like the first week of May and second week of May. So, this is for the day. Thank you.